A Look at Health is underwritten with a generous support of Ellis Medicine, reinventing healthcare one patient at a time.
Welcome back, everyone. Well, as you can see, we're on location today at Ellis Medicine. And the reason we're doing that is we wanted to go in depth with a number of the doctors here at Ellis about some of the topics that we know are of interest to you, concern you, and things that you should know more about. So joining me today, we decided to go to the heart of the matter, so to speak, to start this. And joining me today is Dr. Andalib Nawab. Welcome, Doc.
Thank you.
So can I call you Andy?
Absolutely, you can.
Good, thank you. We're going to talk about cardiology today, but more specifically, how it relates to women and women's health issues. And just to let our viewers know, you've been in practice for 22 years, you were telling me?
About 16 years.
16 years,
Yes,
oh,
yes.
Okay. And the last 8 years here?
Here,
in,
absolutely.
Within
at
affiliation
Ellis, with Ellis Hospital,
Medicine.
yes.
What interests you overall about women's health care?
I was interested in women's health care in general from the beginning when I finished my residency program and I was coming out in clinical practice. But as I started practicing cardiology, I realized that we really need a woman's voice to be talking to women because women take care of everything. They take care of their households, they take care of their children, they take care of their husbands, but they really are not good in taking care of themselves. So they do need a voice in cardiology that it should be a woman who could tell them heart to heart as to how important it is for them to take care of their heart health. Because if a woman is healthy in the house, then everything else is going to be healthy as well.
Well, you know what? I was just going to comment on that. When you think about the nature of a family, and you think to yourself, if the mother is healthy, the family is healthy.
Healthy, absolutely.
You know? And it's an enormous responsibility when you think about it.
Absolutely.
Now, when it comes to heart issues, it's generally thought of that it's men. You hear about men getting heart attacks and whatever. Just roughly speaking, what is the incidence of heart disease amongst women?
It's astronomical. You know, I'm so glad you touched upon that. For the longest period of time, we always thought this is a man's disease. But unfortunately, the problem is women don't know about their risk factors, so they don't seek a lot of medical attention. Classically, the heart-related studies usually comprised of men.
Yes,
so
right.
it was extrapolated that men has more heart disease than women. But the bottom line is that heart disease is the #1 killer of women, more than all cancers combined. We get a lot of buzz on breast cancer. You can just look at the statistics and find out that 1 in 31 women die of breast cancer and 1 in 3 women die of heart disease. So
that's an enormous.
This is an enormous
wow.
number. 1 woman is dying every minute of a heart disease.
Now let me ask you this, Doc. Any particular ethnic groups more vulnerable than any others?
Oh yeah. Once again, unfortunately, among our minorities, Hispanic Americans and African Americans especially are much more at higher risk. And I think, again, the problem is they are not seeking medical attention. They don't think of themselves even dying of a heart attack. A lot of the women are concerned about their breast cancer risks, having serial mammograms. When was the last time you asked a woman, has she ever gone for cardiac screening? That would be foreign to them.
Yes, right.
Because they don't really think they're going to die of heart disease. They think they're going to die of breast cancer.
Well, you know, and the other thing there too is, again, like we started, women tend to think of everyone around them before they even think of themselves.
Absolutely.
You know, and I assume that, you know, we actually, this is something close to home. Our engineer, Norm Hecker, his wife, Lisa, was complaining on a hike that she was having trouble catching her breath. And they thought, oh, exercise it out, you know, the usual tough it out kind of mentality. And they did decide to go have it, and they immediately took her to the hospital for quadruple bypass surgery. But what kind of symptoms would you tell viewers to look for?
I'm so glad that you brought this up, because just in the last 1 year, 2 of my patients have underwent cardiac stenting, and 1 of them have actually undergone quadruple bypass.
Wow.
None of those 3 women ever presented with a regular chest pain. So I just want to let the viewers know in general, you know, the most common cardiac symptom is the chest heaviness and the chest pain that is common to both men and women. But the unfortunate part is that women don't present that way. Women present with shortness of breath, just the way you mentioned in one of your friend's wife, shortness of breath on exertion, profound fatigue. Women are extremely fatigued. They just don't know something is wrong, but they just blame it to menopause, change in life, busy work schedule, and some of the women present with heartburn, feeling of profuse sweating, and a couple of them just present as if they have this impending doom and gloom, severe anxiety. And it's not like you suddenly develop anxiety disorder at the age of 60. This is a feeling, a bad feeling deep down that there's something is wrong. And believe it or not, that's what sometimes women present with. And we gotta tune into those symptoms, know what the unusual symptoms are like, and then go for the correct diagnosis and treatment.
Well, as you can tell, we were covering a lot of very valuable information with Dr. Nawab, so we decided to, instead of editing it, to break it into 2 parts. So this is the end of part 1. You stay tuned for part 2, and to see this interview again, you can head to our website, looktvonline.com.